Okay, ji doctors, welcome back to the class. Today we are going to discuss the third subject of BCSE, that is anesthesiology. Today we will discuss some basics of anesthesiology, and then from tomorrow we will discuss some clinical aspects of anesthesiology. So the basic topics that we have to discuss today includes the following. First of all, we will see at the goals of anesthesia. Then we will move towards the classification of pain, because one of the goals of anesthesia is to produce analgesia, which is basically the absence of pain. So that's why I have added a topic of pain classification and pain pathway. Then we will move towards pre-anesthetic medications, and finally the most important topic, that is anesthetic agents that we commonly use for anesthesia in different animals. And then the next topic would be the stages of anesthesia that we have given a little touch in the group also today. And then we have to discuss some common parts and their functioning in anesthesia gas machine. And finally, we will sum up today's class with some contraindications and side effects of commonly used anesthetic and pre-anesthetic agents. So these are the some of the topics. So the first topic is the goals of anesthesia. Can anyone tell me that what is the basic goal of anesthesia? Why we anesthetize the animal before the surgery? Anyone please in the inbox? Yes, exactly. It is the absence of pain, or you can say the reduction of the pain, because during surgery, when we give the incision or whenever we do any invasive procedure, there is obviously pain. So, in order to reduce the pain sensation, we provide anesthesia to the animal. This is one of the major goals of the anesthesia. And the remaining goals includes the unconsciousness. We have to make the animal unconscious so that he cannot move during the surgery or during any procedure. And then we have to eliminate the autonomic systemic reflexes also. And the last but not least, that is the skeletal muscle relaxation. If the muscles are relaxed, then we can perform the surgery easily. So these are some of the important four goals of the anesthesia. There is another goal which is known as amnesia. Amnesia is not that much important with respect to veterinary side. Amnesia is very much important in the human side. That is another goal of anesthesia. Okay. Then, doctor, if we talk about pain, so there are different types of pain according to the American Association of Veterinary Colleges. There are four basic types of pain that I have enlisted here. These are physiological pain, pathological pain, visceral pain, and the neuropathic pain. Physiological pain is basically a pain that protects the animal from the potential damage. For example, an animal touches a hot object, he will suddenly or he will immediately takes its hand or leg back. Why? Because there is pain, and because of that pain, he is taking his limb away from the hot object. You see here that this pain has protected the animal from the further damage because of that hot object. If there was no pain, he will not take away his limb, and all his limb will be burnt. So this pain will be known as physiological pain. The pain that keeps the animal or protects the animal from the potential damage. Okay. Then the pathological pain, any pain that is happening in addition to the physiological pain is known as pathological pain. For example, if there is any trauma or any injury or any burn because of any physical object, and obviously there will be a tissue damage, and the pain that is because of that tissue damage will be known as pathological pain. And then the visceral pain, as the name indicates, the pain which is because of stress, strain, or any abnormality in the visceral organs like GIT, liver, bladder, stomach. So the pain in any visceral organ will be known as visceral pain. And the most important type of visceral pain is the colic in horses. Okay. Then the next pain is the neuropathic pain. This is type of a very severe pain, which is because of the nerve damage. Whenever there is a nerve damage, it will cause huge pain, and that is neuropathic pain. Got it? So these are some of the types, then I have put some questions for you that you have to find out the difference between pain and dysphoria. These two phenomena are very much similar to each other, but there is still a difference between them. You have to find it out. Then there is a phenomena which is known as wind up phenomena or wind up pain. You have to find out that what is wind up phenomena. Okay. Then, there is a pain pathway that an animal touches a hot object. How this pain is basically perceived, how the message of that pain will reach the brain. There are 5 steps in that pathway. The first step is the transduction. First of all, that hot object signal, which is sensitized by the thermoreceptors, will be converted into the electrical signals. Okay, this is known as transduction. Electrical signals, or you can say nerve impulse. Then this electrical signals will be transmitted to the spinal cord of the animal. This is known as transmission. In the spinal cord, that electrical signal is either amplified or suppressed. This is known as modulation, because the electrical signal is going to be modified. It will be either amplified or suppressed. Then this amplified or suppressed signal will be projected towards the higher brain centers like midbrain, thalamus, brainstem, and finally the cerebral cortex. And when this phenomena is known as projection. Okay. And the last but not least, that step is the perception. When the pain signal or the nerve impulse has reached in the cerebral cortex, it will be perceived, because the pain perceiving center is present in the cerebral cortex. So these are some of the steps that how the pain message moves from the body organ or body part to the brain. So you must remember these steps. Next, there is a question that how you can control the pain. What are the different medications in the market that are used to control the pain? So the first and foremost medication is the NSAIDs, non-steroidal anti-inflammatory drugs, for example, ketoprofen, clonazepam, meglumine, and like that. And then there is a class known as opioids. Opioids are also very potent analgesics that are used to reduce the pain or control the pain. Remember that the mild pain can be controlled with the help of NSAIDs, but the severe pains cannot be controlled with the NSAIDs. You have to use some opioids because they are potent analgesics. And the most commonly used opioid is morphine. And then the third drugs that you can use for controlling or addressing the pain is local anesthetics. For example, lidocaine. They do what? They basically desensitize the area, and when the area is desensitized, there will be no generation of electrical impulses, and ultimately there will be no perception of the pain. And then general anesthetics basically desensitize the brain, and when the brain is desensitized, ultimately the cerebral cortex will also be desensitized. The animal will not perceive the pain. So this is how you can control all of these drugs to control the pain message. Okay. Now there is a question that which step of the pain pathway is inhibited by which drug. So I have enlisted here a brief summary. You can go through it. For example, if I talk about the conduction, so local anesthetics will block the conduction pathway. If I talk about the transmission, so opioids inhibit the transmission of the pain signal. If I talk about the perception of pain, the opioids and general anesthetics, they both can inhibit the perception of the pain. So this is how the different steps of the pain pathway are inhibited by different pain controlling medications. Then the next topic is the list of pre-anesthetic medications. Doctor, you would have listened a word anesthetics and pre-anesthetics. The drugs that are used to induce and maintain the anesthesia are known as anesthetics, and any drug that is used before the anesthetic is known as pre-anesthetic. You would have remembered that you would have studied somewhere that there are many complications that can happen during the surgery. For example, vomiting that can lead to aspiration pneumonia. For example, salivation that can lead to laryngospasm or aspiration pneumonia. So in order to avoid these complications during the surgery, we use the pre-anesthetic medication. Okay. So the basic purpose of pre-anesthetic medication is to avoid the complication or undue consequences during the surgery. And the major undue consequences that can happen during the surgery includes the vomiting, hypersalivation, aspiration pneumonia, hypomotility of the GIT, and the you can say uh, low heart rate. Okay, so these are some of the undue consequences that can happen during the surgery. So we have to address all these consequences or issues before the surgery with the help of pre-anesthetic medications. So the first pre-anesthetic medication that we commonly use is the sedatives and hypnotics. And the major example of sedatives is the benzodiazepams and alpha-2 agonist, which is basically the most common example of alpha-2 agonist is xylazine, and most common example of benzodiazepines is diazepam. Then the next pre-anesthetic medication that we use is the antihistamine that includes the diphenhydramine. They basically act as antiemetics and you can say antacids, and then antiemetics. In order to control the vomiting, you will use some antiemetics like metoclopramide, and in order to control the salivation during the surgery, you will use some anticholinergic drugs like atropine. Okay, then the next drug that you will use is the ranitidine. Ranitidine basically decreases the production of acid in the GIT or the stomach, so the acidity will reduce. And the last but not least, that is a gastrokinetic agent. You know that during the anesthesia or during the surgery, the GIT motility decreases. So in order to prevent this, you will use some gastrokinetic agents, for example, metoclopramide. So these are some of the pre-anesthetic medications that you must remember in your mind. Then the next question that comes is the anesthetic medications. These were the pre-anesthetic medications. Now we are going to discuss the anesthetic medications. There are two classes of anesthetic medications. One is local anesthetics and the second one is general anesthetics. Local anesthetics only reduce the pain, but they do not cause unconsciousness. General anesthetics reduce the pain as well as they cause unconsciousness in the animal. So that is the basic difference between local and general anesthetics. If we talk about the different examples of local anesthetics, you would have listened all these names: lidocaine, bupivacaine, and mepivacaine. These are the local anesthetics that are used for desensitizing the localized area or region of the body. Okay, and how they act, how they cause desensitization, you can go through the mechanism of action. This is the anesthetic agent that is commonly coming in the market with the name of Xyloaid. It contains the lidocaine, okay, lidocaine HCl plus adrenaline. Adrenaline is basically a vasoconstrictor that is used to reduce the blood supply at the level of, you can say, local anesthesia. Then the next is the general anesthetics. The general anesthetics includes, there are two types of general anesthetics. One is injectable and second one is inhalant. Injectable, you know, it will be given through the intramuscular, intravenous, or even subcut route. And inhalant, they are given in the form of vapors through the anesthesia machine. Okay, and the injectable anesthetics are used for induction, means the to start the general anesthesia, and inhalant are used for the maintenance during the surgery. Okay, and the most common example of injectable general anesthetics includes the ketamine, thiopental, fentanyl, and alprazolam. Okay, then if you talk about inhalant, the common example of inhalant anesthetics, you would have listened all these names: isoflurane, sevoflurane, desflurane, enflurane, halothane, nitrous oxide. They are all used in the anesthesia machine, and anesthesia machine is used for the maintenance of anesthesia. So that's why I have added a topic of anesthesia machine and stages of anesthesia also. If we talk about general anesthesia, when you provide general anesthetics to the animals passes through four stages of the anesthesia. The first stage of anesthesia is the analgesia. In this stage, the animal is conscious, but there is no pain. He cannot feel pain. That's why this stage is known as stage of analgesia. Then the second stage, in this stage, the animal becomes hyper excited. The animal behavior become very violent and combative behavior. He will show aggressive movements. That's why it is known as stage of excitement. And the third stage is the stage of surgical anesthesia. This is the most desirable stage because in this stage we can perform the surgery. That's why it is known as surgical anesthesia. And in this stage, all the parameters like blood pressure, respiration, heart rate, all of these parameters are at the normal level. That's why you can perform easily surgery in this stage. This is the most smooth stage of the anesthesia. And the fourth stage that is usually not desirable, it is medullary paralysis. It is very lethal stage for the animal, because in this stage there is overdose of anesthesia, which leads to the depression of the respiratory system and vasomotor center, which results in respiratory and cardiovascular failure or collapse, and ultimately leads to the death or coma. Okay, so this you have to avoid this stage at any cost. Okay, then doctors, I have mentioned P1, P2, P3, and P4. These are basically the four planes of third stage. Third stage can be further divided into four planes. You can go through the details of these four planes. I will share notes after the class. So then doctors, there are some vitals, or you can say there are some parameters with the help of which we can decide the stage of anesthesia. Okay, these parameters includes the pupillary light reflex, respiration rate and pattern, then pulse rate and pattern, then blood pressure. Doctors, in the first stage, you will see that the pupillary light reflex will be positive, respiration rate will be abnormal, means maybe higher or maybe lower, and the pulse rate will be irregular, pulse will be irregular, and the blood pressure will be normal. This is the status of all these four parameters during the first stage. But in the second stage, the pupillary light reflex will be normal, okay, means positive. Respiration rate will be again abnormal, and the pulse rate will be irregular and fast, and the blood pressure also becomes fast or high in second stage. Okay, not fast, it will be high. Then in the third stage, you will see that all the parameters become very normal, okay, very smooth. The pupillary light reflex is absent. Respiration rate, as you can see with the through the pattern, that it is very much normal and smooth. The pulse rate is also very steady and slow, and the blood pressure also is normal. So this is the desirable stage at which you can perform the anesthesia. And the last stage, that is very much dangerous for the animal. In this stage, the pupil dilates and the pupillary light reflex is negative. Means if you put light into the eye, the pupil will not constrict, it will remain dilate. And the respiration rate, as you can see that the respiration has ceased because of respiratory depression, and the cardiovascular system also collapses. That's why the pulse become weak and thready, and the blood pressure also drops. So these are the parameters that you will see in the fourth stage of the anesthesia. Okay, then doctors, I have put some introduction to the anesthesia machine. I should not mention it here because it is a very simplest topic, you can go through it by yourself. But for the revision, I have enlisted the different parts of anesthesia machine. The first part is the flow meter. The flow meter basically controls the amount of oxygen that is going to the patient. And the pressure regulator, that basically controls the pressure of the gases, because if the pressure is very much higher, it can damage the airways of the animal. And then oxygen flush button. This is the button. This is very much important. When you press this button, only the fresh oxygen, only the pure oxygen will be provided to the animal without the addition of anesthetic agent. Okay, then there is a vaporizer. This is the vaporizer. This basically converts the liquid anesthetic agents into the vapors, because the anesthesia machine puts the anesthetic agent into the lungs. If you will put the anesthetic agent in the liquid form, it will cause aspiration pneumonia. That's why first you have to convert the anesthetic agent isoflurane, desflurane, enflurane into the vapors. Then you can provide it to the animal. This function is basically performed by the vaporizer. Then the next is a soda lime canister. If you see here, this is a soda lime canister. It absorbs the carbon dioxide that is coming back from the patient. Then there is a scavenger. Scavenger, I guess it is not mentioned here in this machine because machines vary from company to company. So that's why scavenger is not mentioned here. Scavenger is basically responsible for absorbing the used gas, because when the anesthetic gas goes into the patient, Obviously, when the patient will exhale, this gas will come out, and this gas is basically absorbed into the scavenger system. It contains, I guess, carbachol or charcoal. I don't remember. I guess charcoal, yes. Then the last is the reservoir bag. This is the reservoir bag, or I guess it is also known as maybe ambu bag. Might be possible. You have to go through it, confirm it. Reservoir bag basically contains the oxygen and it is used for the emergency situations. Okay. Then how the gas comes into the anesthesia machine, how it goes to the patient, and how it comes out of the anesthesia machine. What is the pathway of the gases, flow of the gases through the machine? I have enlisted the pathway here. You can go through it. Okay. Then the last topic that we have to discuss today is the contraindication and side effects of the different anesthetic and pre-anesthetic medications. The first medication is the ketamine. We discussed that ketamine belongs to the injectable general anesthetics, and when you inject ketamine in the cats, the eyelids of the cats remain open. Okay, when the eyelids will remain open, the eyes can dry and it will cause consequences. So in order to provide it, you must add cedar oil or any mineral oil in the eyes of cat to prevent the dryness of eyes. Then the second side effect of ketamine is the seizures. It causes seizures in the animals. So you cannot use ketamine in those animals who are already suffering from seizures or epilepsy. And third is that it increases the intracranial pressure and intraocular pressure. That's why ketamine cannot be used in head injury and glaucoma patients. Because in head injury, the intraocular pressure is already increased. If you will use ketamine, it will further sphere the intracranial pressure. And similarly, in glaucoma, the intraocular pressure is already increased. So if you will use ketamine, it will further make the situation aggressive. Okay. Then the next drug that we have to discuss is the alpha 2 agonist. The common example of alpha 2 agonist is the xylazine and dexmedetomidine. Xylazine basically causes vomiting in cats. That is the common side effect, and it is contraindicated in heart patients because xylazine or dexmedetomidine they cause bradycardia. Okay, so those animals who are already suffering from a heart disease, you cannot use alpha 2 agonist in those patients. Then comes the diazepam. Diazepams basically damages the liver, so that's why diazepam is contraindicated in those patients who are already suffering from the liver disease. Then comes atropine. Atropine is basically a pre-anesthetic drug which belongs to anticholinergic class, and anticholinergic drugs causes the paralysis of the intestine in the horses. Okay, you can say hypomotility of the intestine in horses. So that's why they are contraindicated in horses. And they are also contraindicated during reflex bradycardia. What is reflex bradycardia? I told you that alpha 2 agonist causes bradycardia, decreased heart rate. And this is a normal mechanism. Okay, this is a normal physiological mechanism that whenever you will inject the alpha 2 agonist, animal will suffer from bradycardia for sure. Okay, you do not have to inject atropine in order to address this bradycardia, because this bradycardia is not a pathology, it is a physiology. So this type of bradycardia is known as reflex bradycardia, and you should not inject atropine to address this bradycardia. You should leave the animal on its behalf. It will recover on its own. Then the last drug is the gabapentin. Gabapentin is basically used for the neuropathic pain. And when you use this medication for long duration or in high doses, it causes a side effect which is known as sleepiness. Okay, sleepiness is the side effect of gabapentin. So doctors, this is all about the basics of the anesthesiology. From tomorrow, inshallah, we will discuss some clinical aspects of anesthesiology, that how we have to induce the anesthesia, how we have to maintain the anesthesia, which anesthetic agents we can use, which we cannot use, how we have to assess the anesthesia. So all of these clinical topics will be discussed tomorrow. If you have any question, you can ask in the inbox or in the class group. So this is all about today's class. Thank you very much.